All right, Chapter 6, Promoting Excellence in Long-Term Care. Long-term care describes a variety of different services, including medical and non-medical care, and it's for people really of all ages who have some kind of chronic illness, physical, cognitive, or developmental disability. Can be formal or informal. And most people with long-term care need to live in their own home with family and friends or volunteers providing care. As the number of aging people increases, the number of long-term care services that are needed increases. Most families in the coming years will have a member of the family that needs some type of long-term care support. With shrinking family sizes, there will be fewer potential caregivers, and the estimates are that spending on long-term care will increase fivefold by 2045 in the United States. Long-term care is expensive. It's becoming more expensive. It's usually, a lot of times it's funded by Medicaid in the long-term care facilities. Most people have not adequately planned for their long-term care, and the majority of long-term care is provided by unpaid caregivers. And like I said, funding largely is Medicaid, where Medicaid is the primary payer for the services. Medicare does not cover for long-term care services unless there's some kind of nursing skill that's needed. Private long-term care insurance, this is what we've talked about before, and that you can get private long-term care when you're younger to pay for when you're older, but not a lot of people have done that. And then about 40% of all paid care is out-of-pocket spending. In the United States, the long-term care system is not very funded, not funded very well, and it can be really difficult to navigate. There's not really a good comprehensive approach to care coordination, and it can be, the supports and services may not be provided in the most appropriate setting by the most appropriate provider. So what are the goals of long-term care? One, you want to provide a safe and supportive environment for the chronically ill and functionally dependent people. Maintain and restore the highest level of functional independence. Preserve autonomy. Maximize quality of life. Provide comfort and dignity for end-of-life care. Prevent acute illnesses and create a home-like environment. There is something called PACE, which is the Program for All-Inclusive Care of the Elderly, that your textbook mentions. You can look at that. It provides services to people 55 or older who would otherwise need a nursing home level of care. Then you have the adult daycares or adult day services, and these are programs in the community where maybe if an older person is living with a family member and the family member has to work during the day, they can bring this older person to the adult care center, which is usually in a long-term care setting, long-term care home, and they can be there for the day, and then they can pick them up at the end of the day. So that can be really helpful and can be a form of respite care for caregivers. Community care, there's residential care or assisted living. This provides housing and services to older adults in the United States. Many older adults would move to an assisted living community if they could no longer care for themselves. Usually in assisted living, there's independent living, which is still they're living by themselves, but there's usually some kind of resource if they need it. Then assisted, but they take care of themselves, they give their own medications. In assisted livings, usually there is a nurse on staff, and usually they give the medications to you. They have a list of medications and they give them. So it's definitely more care. Nursing homes, these are facilities that provide around-the-clock care for people who need specialized care. Their complex healthcare setting, it's a mix of hospital, rehab facilities, hospice, and dementia-specific units. Nursing homes often have two levels of care. You've got the skilled nursing unit and then the chronic care, which is the long-term, home-like unit. There's about 16,000 certified nursing homes in the United States, and the majority of nursing homes are not for profit. Nursing and long-term care, you will see that there's the majority of the care is done by CNAs, and then you've got the LPNs who tend to be in charge of patient care. Underneath that, you've got the medication techs who pass all the medications, and then RNs have been, in my experience, do a lot of the paperwork and the administrative work. But having more RNs in the nursing facilities has been associated with things like fewer pressure ulcers, fewer hospitalizations, fewer UTIs, and just fewer problems in ADLs. So there have been benefits. There are benefits to having RNs. The long-term care providers, usually, like we said, it's skilled nursing care and chronic care. You've got the subacute care, which is more intensive and usually more expensive, and then the chronic care, which is their living residents. This tends to predominantly be women, usually 80 years or older, who are widowed or maybe need help with some of their ADLs. Nursing assistants, as I said before, provide the majority of the direct care for nursing homes. There's a critical shortage of nursing assistants. Unfortunately, I don't think they get paid as well as they should. They typically are lower paid, and so we really need to support our nursing assistants. There is such a thing as the Resident Bill of Rights in the long-term care, and these are a list of rights that a resident has. Each facility is required to post the Bill of Rights, and also to post someone they call them an ombudsman. An ombudsman is an advocate that can be an advocate for someone in the facility, and also talks about a resident has the right for people to visit, time for their family. They have a right for health care and legal advice. The quality of the care in the skilled nursing facility, nursing homes are one of the highest, most regulated industries in the United States. They have a lot of quality indicators, which they're the results of the quality indicators and of those measures are public knowledge for people to look up. And one of the things that's helped to increase quality of care in the nursing homes is having advanced practice nurses and nurse practitioners work in the nursing homes and provide care in the nursing homes, and that has increased the quality of care. For choosing a nursing home, I would definitely recommend visiting the facility, meeting with the director of nursing, really watching and seeing how the daily interactions and how people are cared for, and being able to ask questions. All right, and that's the end of this section.